Hi, welcome to this fourth series of the My Translation Rules webinars on measuring outcomes, avoiding wasteful data collection. My name is Dr. Sonia Osborne and I am the Implementation Scientist at the Australian Centre for Health Services Innovation, otherwise known as AUSHI. Key learnings for this session. At the end, you will be able to explain what you want to measure in your implementation projects and why and how. Choose some appropriate outcomes for your own implementation project, and identify appropriate data to collect and also data collection methods to measure those identified outcomes. I'll make a few assumptions here, and that's that you've actually seen the first three webinars. So you're pretty happy with evidence-based practice and critically appraising evidence, and are aware of 5 things important to know before you start working on your implementation project. Along with that, hopefully you've had a chance to do some reading around those theoretical frameworks I mentioned, and maybe found some others and thought about one that you might want to use to guide your own project. So before we start, let's stop the show. And in your groups or on your own, just answer the following. Thinking about your own project, what are some of your key outcomes and why these are important? When you're ready, restart the presentation. So remember those 5 things to know before you start? Be clear about your aim and innovation. Understand the context. Engage people throughout the process. Develop a clear, logical plan for change. And build support for sustainability. So I'd like to add a sixth reason why implementation fails. Measuring nothing or measuring everything. Can we turn that around? We can choose the outcomes needed to conceptualize and evaluate success. So don't choose any more than you need, just choose those ones that need to conceptualize and evaluate success of your implementation project. First, you need to be clear about your aims. That's always going to be the key. If you don't understand what your aims are, you're going to have a hard time defining your outcomes. So be clear about your aims. That's what you want to achieve. That will be your outcomes. After that, you need to measure outcomes of interest to your stakeholders. So it's not just outcomes you're interested in, but remember we talked about your stakeholders being anybody who has an interest, something to gain or something to lose with the initiation of your project or your plan. So that can be the clinicians, the patients, it could be the people who manage the day-to-day of the wards or the units or the services. It could be funders, it could be supervisors, so anybody who has an interest. And then avoid a narrow focus on outcomes which do not consider non-scientific factors and which do not consider process. So these are probably key factors in evaluating an implementation project. If we don't know how the process went, we can't really say that the intervention is actually effective or not. So remember that logic model we had, and you had your evidence-based innovation, you did some activities or methods to effect some change because you wanted to see some outcomes that would lead to some impact. So with a logic model, it's just a logical framework, and it's pretty simple. It's based on a theory of change, so therefore the arrows are indicating that's the direction we're going. What it can be used for is doing planning and implementation. So we'll just overlay that logic model with the actual logic model parameters. We've got resources and inputs, activities leading to outputs, which lead to outcomes, which lead to impact. And what we can do now is look at change. We'll put change in there because change is what you're actually trying to do, change behavior, change service. So now let's overlay that logic model with an implementation science lens. And you can see the implementation factors and processes are at the beginning. They're your inputs and activities. So that's your innovation, that's whatever resources you might have, whether that's staff, space, things. Then you've got your implementation outputs, and this is what the implementation factors would produce. So it might be a training program, it might be a more knowledgeable workforce. Those are the outputs. Then your outcomes, you have your short-term and your intermediate outcomes, and these are really interim changes that occur as a direct result of your outputs. And then hopefully they will lead to your long-term outcomes and impacts. And these are changes achieved over time. So when you look at your logic model, it's also underpinned by some assumptions, and you would identify those assumptions. It's underpinned by the theoretical framework you are using to guide your implementation project. And then you've got some awareness of the organizational capacity and the contextual factors, because you've done a context assessment and you've done some engagement with your stakeholders to find out or identify some barriers or facilitators to change. So one thing to remember is that intervention or treatments won't be effective if it's not implemented well. And this is really the difference between intervention failure and implementation failure. And you want to know, did it not work because the intervention was ineffective, or did it not work because it wasn't deployed correctly, which is implementation failure. And you need to know if it was implementation failure, because that will give you some indication as to what you might have to do to change it in whatever way to scale it up or roll it out. So what do we actually want to measure? Well, we need to measure not only outcomes, but also process. With outcome evaluation, it provides decision makers with the tools to assess whether you've actually achieved those objectives you set out to achieve. And some of the measures around outcomes would be those clinical measures. It could be about health conditions, it could be quality of life, maybe knowledge or attitudes, changes in behavior. With process, we next move on to process evaluation. That helps to identify strategies to improve the quality and the delivery of the program. So that's pretty much tied to what we talked about in the last webinar about fidelity. If there's a training program involved, was it the training program delivered consistently across all groups? If there's some referral process, was the referral process followed in the same way, adhered to across groups? Was the trainer the same, or the trainer's equivalent in the program? So it's about quality. Also, with the process evaluation, it looks at the types and quantity and quality of activities or services provided. But it does this, usually there's some narrative way of doing it. But what it does is assists in identifying if the implementation has actually impacted on the achievement of the outcomes. And that's what you really need to know. So with the outcomes, that will tell us the what. Did our intervention or our initiative actually work? Was it effective? With the process evaluation, that will tell us the why and the how. So here is a conceptual framework for implementation research. And this was developed by Proctor and colleagues in 2009. And this is seminal research, because this is the first research or scholarship that differentiates service outcomes from your actual clinical outcomes from the implementation process outcome measures. And you could see it's developed along the lines of a logic model. There's the evidence-based practices at the beginning, then there's the activities or the strategies that you're going to do, which they indicate that strategies occur across multiple levels, so across the systems level, targeting the organizational level, targeting the individuals. And then there's your outcomes, which are divided into your implementation. So with the implementation outcomes, they see that the service outcomes and the client outcomes really hinge on the successful effectiveness of these implementation outcomes, or the successful achievement of these implementation outcomes. And I'll just put that logic model up again to reiterate that. So just while I'm here, the outputs of course, are the measurable products of the activity. So really the outcome measures don't tell anything about the value or impact of your service. It's the outcome measures that do that. So Proctor and colleagues define implementation outcomes as the effects of deliberate and purposive actions to implement new treatments, practices, and services. So they've also told us about 3 functions, and these are make it a little bit reasonable to understand why we need to collect implementation outcomes. Implementation outcomes would obviously be indicators of implementation success. So you could see those outcomes there: feasibility, fidelity, penetration, acceptability, sustainability, uptake, and costs. And we'll talk about them a little bit later. They're also proximal indicators of implementation success. So you could use them to gauge whether you're tracking along all right. And then they're intermediate outcomes relative to service and clinical outcomes. So what they're saying is basically the service outcomes you achieve and the client outcomes you achieve are hinged upon the successful achievement of these implementation outcomes. So now just let's look at these outcomes in a bigger screen so we can have a look at them. And these are practice outcomes divided into implementation, service, and clinical. So you can what I'm going to do now is overlay that with some Australian context. And this is the National Health Performance Framework. And these are some indicators that the National Health Performance Framework uses as benchmark indicators. And you can see with the service ones, they certainly cross over with Proctor's outcomes. So they're the ones in blue, the National Health Performance Framework ones. And then they have a few other ones under health status or clinical, such as function, health conditions, well-being, and sustainability, which they've actually put on the service side, but Proctor has it on the sustainability side. So now let's just look at a few of those implementation outcomes. So here's some definitions, some brief definitions, and these are Proctor's definitions. So I've put that reference at the end of your presentation. And most of these are pretty important to sustainability. I would say all of them are probably important to sustainability. So acceptability is whether people actually, agree that it's a good thing and it's satisfactory. Adoption, they're actually going to try it or take it up. Appropriateness is related to fit. So if the intervention doesn't fit the population, there's no real sense in trying to implement it in that group. Cost, as you can see, really it crosses over with efficiency in the service realm, and efficiency is about cost effectiveness, so cost effectiveness or cost savings. Then you have feasibility, which are reported is tied up to sustainability. So I would urge you to read that Proctor paper, because Proctor also gives some guidance into some indicators you could use for each of these outcomes, and also some challenges with measuring these particular outcomes. And also I would urge you to go to that National Health Performance Framework, and they also provide some definitions for those service outcomes as far as the Commonwealth's framework goes. So now that you have your outcomes, how will you know that change has occurred? Well, you have to measure. Choose the appropriate measures. You have to identify your measurement sources and the tools you're going to use. Select the data collection methods most appropriate, and then determine how often to measure. And you're only going to know if you made a difference if you measure at baseline before you start. So some types of data you might want to be looking at would be quantitative data and qualitative data. So with quantitative data, these methods would help you answer the who, what, where, and how much. They're usually numbers. It's more structured and standardized, so you use the same procedure to get the data from every person, every event, every case in your population or catchment area. With qualitative methods, it answers the why and how, which is really the important thing about implementation science. We want to know the why and how. Why and how are they taking up this or adopting this innovation? Why and how are they sticking with it? Are they coming back? And why and how are they not? It emphasizes words instead of numbers, which implies you're going to have to talk to people, maybe focus groups or interviews. It does present some challenges with how to organize this data, and there are frameworks, going back to the frameworks to guide it, and the theoretical frameworks. You can use the theoretical frameworks to organize the textual data you get from qualitative studies or qualitative methods. So, what data collection methods and what measurement tools can you use? Well, we're thinking about that in relation to quantitative data and qualitative data. So for quantitative data, the main purpose, of course, is to quantify the data. So you could do surveys, you could count frequencies. For instance, you could work out how many people actually attended a clinic, or how many people ambulated within the required time frame. You could also collect monthly metrics. What I mean by monthly metric collection is the data already collected for some other reason on the ward routinely? If there's routinely collected data or administrative data that you could tap into, try to take advantage of that, because it's no sense in you making up a whole new data collection sheet and collecting the same data over again. And then there's self-report measures, which could be online or could be a paper copy of a reporting tool. And fidelity measures, and we talk about fidelity quite a bit. And fidelity measures, there would be some fidelity measures that are available in the published literature that you could use. Now, the other side of that is the qualitative data we need, and that's suitable for gaining an in-depth understanding of underlying reasons and motivations. So what you want to be doing is maybe some semi-structured interviews, or with key stakeholders, or some focus groups, and also you could do observation. So you could observe compliance, and you could keep field notes to monitor adherence in that way. Some other examples of impact or outcome indicators might be changes in awareness, knowledge, or skills, and we mentioned that one. Increases in the number of people reached. Policy changes in behavior, whether people are actually doing the thing you want them to do. Changes in community capacity. So this might have to do with, self-management. If you're looking at patients being able to self-manage, and communities being able to self-manage, are the GPs able to manage people or patients with diabetes or ADHD without having to refer them to the specialist clinic? Changes in organizational capacity, changes in the service usage, and then improved continuity of care. So people are getting through the system with limited barriers to moving through the health system. How often to measure? Well, we talked about baseline. So you need to collect data at baseline at least, so that you've made a change and a difference. Then you're collecting data throughout the process of implementation, which would be considered formative evaluation. And the reason you're collecting this data throughout the course is that you want to be able to keep tabs on your progress of achieving your outcomes, because you don't want to get to the end and then not achieve your outcomes, and then mistakenly determine that the intervention was ineffective, when really it was the implementation process. But you have the opportunity, if you collect data during the process, to actually see where things are falling down and make some corrections before it's finished. So at the end, you're collecting your final summative evaluation, and then I've just put ongoing there to just touch on the point that this is probably a good idea for sustainability after implementation. And why that's important is because you want to try to build the evaluation and monitoring into the routine of the unit or service, so that the area can accept responsibility for this, and then continue to evaluate the achievements and the outcomes of the intervention. So what I would suggest is for you to develop a data collection matrix. It's just a simple table, but it allows you to identify your outcomes, identify those indicators that you are going to use to measure those outcomes, where you're going to get that information, how are you going to get that information, the time points you need to collect the data, and then who's responsible for it. And if you can put it on this data collection matrix, it will be make it easier to discuss with the team, with the project, with the staff, so they know what's happening and they know what is expected of them. So let's stop the show. On your own or in groups, just have a rough go now creating your data collection matrix. Think about those outcomes you thought about at the start, but then also add some ones you've been thinking about since the presentation's been going. And use your networks in these discussion groups to identify some existing sources of data and also some data collection tools you might be able to use. So when you're ready, restart the presentation. Now, I think this is going to be pretty much the second to last slide in the presentation, so spend as much time as you need on this one, but leave about 2 or 3 minutes to wrap up. So, key points, preparing for implementation. You need to describe the outcomes you want to achieve, and these are based on your aim. Turn those identified outcomes into a quantitative or qualitative measure or indicator as appropriate. Confirm that your desired outcomes are actually linked to your outputs or your activities. So that goes back to your logic model. Everything needs to link. If you're finding that you've got some activities in there that aren't actually going to make any difference to achieving your outcomes, get rid of those activities. You're trying to streamline it. And then implement these outcome or data collection measures and track them over time. So the take-home messages: measure outcome and process. And you need to know your starting point to know if the change has made any difference. So I hope this webinar series has helped you, and good luck with your projects. The next slide will just be some references, so you can leave that up for a while and have a good time.